How do we treat patients better? How do we improve survival? How do we improve side effects of treatments? And to me, that's science, and that's part of why I went into medicine to begin with.
I think one of the reasons why it's important to have research at the hospital that you're working at is because it really raises the level of care that I think everybody receives.
The Institute is the research and education organization affiliated with Essentia Health, and we're all about looking to see how we can improve things for the future. The Essentia Health Foundation and the different foundations within that organization have been instrumental in supporting the Essentia Institute of Rural Health's research efforts since its inception.
The Essentia Health Foundation here has been critical to helping provide funding for heart and vascular research. We've done research at Essentia for over 30 years in heart and vascular. We've started with a lot of the devices like pacemakers and defibrillators from the companies that were based in Minnesota.
When we're able to have funds that allow us to start up these research efforts, what that does is not only provide us the benefit of that actual research that happens right there, but it allows us to build our reputation within academic medicine, and that leads to more financial support.
We believe that part of our work is bringing it to their home clinic and to bring it to these smaller cancer centers where our physicians see patients, so our physicians should also be able to participate in the research process at the patient's home. The foundation really is critically important for three parts. One is infrastructure. The second is really some direct patient support. And then the third part is really directly supporting some very specific research projects that we develop locally. But I also feel like I'm personally hurt when I get into situations where I feel I have nothing more to offer. And that's what research is meant to do, is to figure out how do we do this better? How do I offer more? And so I always tell patients and families, particularly as we get towards the end of a cancer journey, is that I want them to know that my job is to help others down the road and to figure out how to do it better. And that's why I do research. And so, frankly, it's one of the most fulfilling parts of my job, and so I don't think I could be a cancer doctor without that as part of my work.
I think that research is really global these days. There's no borders, and so we are routinely working with folks from Canada and Europe and all over on a number of our large clinical studies.
It's inspiring to work with people who are so committed to making a difference, and to be able to be part of this team where we are strategically guiding the efforts to make the biggest impact for our population of patients here at Essentia is something I am just incredibly proud to be a part of.